Hello, I'm Dr. Tracy Mountford and I'm a cosmetic doctor, and I'm here today to talk to you about CoolSculpting. The interesting thing about CoolSculpting is that it's a non-surgical fat freezing treatment that to date has had over 7 million treatments worldwide. So no scars, no surgery, no downtime. Generally, there are two ways of non-surgically treating fat. One is by heating fat, and the other is by freezing fat. And CoolSculpting freezes fat. The big win areas for CoolSculpting are numerous. The obvious one is the abdomen, and this one is very, very popular for men and women of all ages. And we can also treat the inner thighs or outer thighs to slim and contour. Another very popular area for CoolSculpting is the upper arm area. And again, in our practice, a big win treatment is for the double chin. CoolSculpting is a medical treatment performed in doctor-led clinics. Your first consultation is probably the most important part of the process. It's at that point you make an assessment of the practitioner, whether you're confident in what they can achieve, and it's their opportunity to assess you properly, to show you before and after photography of the areas that you're particularly interested in having treatment for. And ultimately, a practitioner will share with you everything that they've experienced. It's also important for your practitioner to be highly visual. What we do is get you in a room with a mirror, and we stand you with your arms outstretched, and we rotate you round so we can look at you from every single angle possible in order to assess what result we can best give you. Your practitioner will tell you exactly the number of treatment cycles it will need to give the very, very best outcome. Your practitioner would have worked out a treatment plan for you when she first met you at your initial consultation. The day of your treatment, you should ideally come having had something to eat and drink so that you feel very comfortable. You should wear comfortable clothes, and your practitioner would have told you about this beforehand. The usual thing that happens is your practitioner will greet you, take some photography, consent you for the treatment, and get you comfortable in the treatment room. It's a comfortable procedure. You should be able to watch TV or listen to music while the procedure is being done. When the treatment's finished, the practitioner will massage the area. And this, of all of the things, is probably the most pinchy and the most uncomfortable. But it's a very important part of the process. And what that does is it helps break up those little crystallized fat cells so you get best result. The discomfort will only last literally a few moments, but it's well worth it. And once she's finished doing that, you can just relax, have a refreshment, and take your time to get dressed. Afterwards, the treatment area will be a little bit uncomfortable. It might be a little bit numb, but that's completely normal. You should still be able to exercise and do everything you normally do. Your practitioner will then book you for a review of the treatment at about 8 weeks. It's at that point she will assess your treatment result and see how things are going. A question I'm often asked is, am I the kind of patient that should be considering CoolSculpting? Our ideal patient is someone who is average weight, but has stubborn areas of fat that they can grab and actually just want to redefine and recontour. I've been using CoolSculpting in my practice for many years, 6 years now, and there's published data to support the fact that with each area that's treated, we can get up to 27% fat loss. If you think of this as being an arm width, and we actually take away at least about a quarter of that arm width, you can get quite a significant reduction in fat, and it has quite a big impact on the way we look and the way we feel. The most important thing to consider when you're having a cosmetic procedure such as this is, does it work? But also, is it safe? CoolSculpting has been FDA cleared since 2009. The very clever thing about CoolSculpting is that inside the applicator head, there are little detectors that actually register in live time all the temperatures coming from different areas of the body that are being treated. This means if there's any unusual change in temperature during your treatment time, the equipment registers that and will shut off.